Well, one of the medical experts leading our state's response to the coronavirus pandemic is Dr. Ryan Westergaard. He is Wisconsin's chief medical officer and state epidemiologist for communicable disease. Dr. Westergaard, thanks so much for being with us today. I want to use every moment of our time here, so I'm just going to launch right in with my first question. Governor Evers just announced an extension of the statewide mask mandate through essentially the end of November. Critics of the mandate point to the rising numbers of COVID in Wisconsin as evidence that the policy doesn't work. I think I know where your answer probably is headed, but I'll put the question to you this way. If at the same time we're under the mask order, we're also seeing record spread of the virus, what's the justification for extending it?
Well, masks have evidence as a useful tool to prevent transmission. Clearly, they're not the only thing that prevents transmission, and certainly focusing only on masks isn't going to be enough. So masks and physical distancing and strict attention to isolation and quarantine when we find cases are how we break chains of transmission. So it's true that the mask mandate hasn't prevented a surge altogether, but there are some data that are encouraging in ways that have been beneficial. For example, we've seen the number of cases in workplaces go down since initial surges in factory and food processing plants. We've seen cases acquired in healthcare settings go down quite a bit. And I think that's in large part to the fact that we now have sort of universal masking behavior in those settings. So that the challenge is to have more mask wearing in more settings as one piece of our response.
But you definitely think we'd be worse off had we not had the mandate?
Well, I think those other sectors where outbreaks are possible in hospitals and long-term care facilities and other places where congregate would be at higher risk. So I do think it could be worse than it is.
We've talked a lot about, just had this story about UW. We've talked a lot about college campuses and the spread there. More than 2,000 cases or COVID positives at UW, your alma mater. These are positive tests, doctor, but I'm curious to know if you have information about the severity of illness among these teenagers and 20-somethings. Are a lot of them really sick, or are many of these COVID positives where people have very mild symptoms?
Yes, it's a really important question. Thanks for asking it. So one of the tricky things about this virus, it's both a good thing and it's also it has some challenges embedded, is that there is such a wide variety. In this younger age group, in the 18 to 24 range, the majority have mild symptoms that don't require hospitalizations. And we don't know the precise number. Those data are always sort of in flux, but there's only been one or several UW-Madison campus students who has required hospitalizations. So that's the good news. The bad news is that people that have mild symptoms tend to be more active, tend to interact more, and that can fuel transmission in the community to where everybody else is at higher probability of becoming exposed to the virus. And that's really the danger, because on the other side of the age spectrum, people in their 50s, 60s, 70s, the majority of those have more significant illness in a higher rate of hospitalization. So that's really why it's a whole community level response we need to stop transmission.
Let's talk about the kids in school, primary education. We had a story out of our northern suburbs in Milwaukee of one of our local health departments reporting multiple situations where parents have knowingly sent COVID positive kids to school. I imagine that's alarming to you. So could you comment on that and just the broader picture of concern as we've sent kids back to class in person in the state?
Yeah. I think that highlights one of our greatest challenges in the overall response is that, certainly one of the most important, probably the single most important strategy for preventing the spread of the disease is people staying home when they're sick, that isolation of people when they become cases. So the fact that some people don't feel able to do that speaks to a much larger challenge that we have as a community or as a society. In order for all the testing, we pay a lot of attention to getting people testing, getting people their results. If we can't link that to a safe situation where people can recover at home and not be in contact with others, we're not going to be able to break chains of transmission. And so when I hear about people feeling like they really need to go to work when they're sick, when they need to send their children to school because they don't have other arrangements, that really speaks to the need for more community supports, more social supports to understand what do people need and able to do this safely. It's a big challenge. It's not surprising that we hear about people going to work in school, but it really identifies one of our biggest challenges as how we get through this, is how do we make communities resilient so people don't feel the need to go to work or go to school and have support to be able to stay home.
I'm running out of time, Doctor, but there are two things I still have to get to. More of an alert to my producer here, as I'm probably going to go a little long. I did solicit some questions from people on Facebook today, and I wanted to address one that I hear a lot. This particular question came from Mike on my Facebook page. He said, and granted, this is anecdotal, but he said he's heard from 4 people who were signed up to get a COVID test, but didn't actually go out and get the test, but then later received notification that they had tested positive. It's important for people to be able to trust the numbers that they're hearing from state each day. Have you heard of cases of that happening? Is this actually a reality?
Yeah, I have not heard about that. So in our community testing sites, we do have an online registration system where you can sign up ahead of time and you'll get emails back in response to confirm after you get the test. If someone's getting a result having not been tested, that means something's broken, and we'd be happy to look into that, but it's not something that I've heard about so far.
All right, last thing for you, Doctor. I remember the H1N1 outbreak vividly because I was a new dad at the time, so I was freaked out, as a lot of parents were. That was a disease that was killing healthy children. And I think about that as, I get this question a lot from people. We didn't close schools then, we didn't take extraordinary precautions, we didn't shut down businesses, social distancing wasn't a thing. So why now, as we know what we know, particularly like what we talked about with the younger population, why are we treating COVID-19 so differently? Could we not just allow that to run through our population, knowing that the vast majority of people will get better if they get it?
Yeah, it's a great question. There's a lot of nuance there, but I'd say the most succinct way to answer it is that on a population level, this virus, SARS-CoV-2 virus, is several times, perhaps as many as 10 times more deadly than influenza. And there is that wide spectrum where young people don't get severe illness. But if we are going to prevent the potential hundreds of thousands of deaths, we need to have a community-wide effort to keep transmission as low as we possibly can. So closing schools and doing these things is not only to protect children from getting infected and sick. Closing schools and businesses and social distancing is a way to protect the entire community, particularly the vulnerable people in the community, because the hotter that this fire burns, the more transmission, the higher everyone's risk is. And this virus is particularly deadly for older adults and people with medical problems. And if we don't do these really aggressive things that affect the whole community, we're going to have a lot of severe illness and deaths that we could prevent.
Dr. Ryan Westergaard is the state's chief medical officer. Doctor, it's good to talk with you. I have a million more questions, but I'm in enough trouble already for running over. So I appreciate your time today.
Okay, be well.